Charleigh Pollock is one of a kind, the only British Columbian with Batten disease.
Having to fight for your child to exist is not okay.
The drug Charleigh has been taking to combat seizures caused by her neurological disease.
Everybody wants this to be different for Charleigh. And I think everybody's heart goes out to her and her family.
It's your birthday today.
9-year-old Charleigh's final dose will be on Thursday. Multiple reviews by independent bodies determine the medication no longer providing any clinical benefit. All drugs eligible under BC's Expensive Drugs for Rare Diseases process goes through what the province calls a rigorous, fair, and evidence-based approach.
It is so vitally important that we rely on the medical evidence, the clinical evidence, and that we have these independent, robust processes in place to make these difficult decisions.
The drug costs around $1 million a year. That's about $30,000 a dose. The family says Charleigh went from experiencing more than 100 seizures a day to none while using the drug. But there's no cure for Batten disease.
The cost of the medication has nothing to do with the recommendations that come forward from these independent medical experts.
A politician in this province has never overruled the decision made as part of the rare disease treatment process. But the opposition Conservatives say, although they don't question the clinical analysis, they do believe the government's lack of communication was morally indefensible.
Where was the supports for this family through this ordeal? Where was if it had to come to that, knowing that the decision was likely, where was the end-of-life planning, the mental health supports?
A GoFundMe page has been set up for Charleigh's family. Her mom plans on responding to all of this soon while she continues to process the devastating news. Richard Zussman, Global News, Victoria.